Good afternoon, everyone, and welcome to today's CPD session. Firstly, I'd like to thank you all for taking the time to join us. We're really pleased to have so many of you here today for what promises to be a very informative and practical session. My name is Will. I am the owner and director of Apex Experts. Um, and By way of brief introduction for those who might not be familiar with us, Apex Experts provides specialist medico-legal expert witness services, working with a wide panel of highly experienced clinicians across a broad range of specialties. Our experts provide CPR compliant reports for both claimant and defendant instructions, and we work closely with legal professionals, insurers, and case managers to support complex clinical negligence and personal injury claims. Just a few quick housekeeping points before we get started. As you might have realized, the session is being recorded. That's just to allow us to share the recording, obviously, with you all afterwards and ensure that anyone who couldn't attend today can still benefit from the session. Everyone attending today will receive a CPD certificate following the session, and these will be sent out to you via email automatically after this afternoon. To help keep the session running smoothly, please ensure your microphones remain muted throughout the presentation to minimize background noise and interruptions. If you have any questions during the session, please feel free to jot them down or type them into the chat box at any time. Wendie will encourage you to ask any questions you have during the presentation itself, instead of waiting until the end. And if you do experience any technical issues during the session, please feel free to use the chat function to let us know, or simply leave and rejoin the meeting if needed. Now, it's my pleasure to introduce today's speaker, Wendie Smith. Wendie is an advanced nurse practitioner. She's a non-medical prescriber and Queen's nurse with over 20 years of clinical experience in nursing, including extensive work in primary care, community and district nursing, urgent care, and telephone triage services. She has also served as a medico-legal expert witness since 2018, providing CPR-compliant breach of duty reports, screening reports, and letters of advice for both claimant and defendant instructions. Today, Wendie will be sharing her insights as a nurse expert witness on choosing the right nurse expert for your case. And now, without further delay, I'll hand you over to Wendie. Wendie, if you would like to start.
Thanks, Will. Thank you very much, everybody, for joining. I approached Will and I did express that I would just quite like to put out there how, as nurse experts, how we grow. And I thought it would be a great session, exchange of ideas and information for you to understand how experts develop their experience and how they start out. I started out in 2018. I applied for a job which was for an expert witness, and I undertook a qualifying course. I haven't done the formal CUBS course that's on so long, but I've become very interested in growing new experts, because I do believe having a large amount of people that are able to not only give their clinical expertise for the course, but be able to write the medical legal reports in the language necessary is key. So I put together a presentation. I'm very happy for you to ask questions throughout. So please, let's make this a conversation, because I think that's how we all learn as well. Okay, so I thought about what factors determine good expert selection, and as well as lots of others, I tried to narrow it down, and I've considered clinical expertise the most important. Medical legal acumen, if you can't get your opinion down on paper or in court, then that makes the whole challenge of being an expert more difficult. So you may have the clinical expertise, but if you can't actually give that expert opinion, then you're going to struggle, which then leads us to the communication aspect. Okay. And I believe that selecting the right expert with the right experience is key. And sometimes the pool's quite shallow, especially for specialist subjects. My remit is advanced practice in general practice, and I also comment on general practice nursing, district nursing, and social care because of my wide experience. And I think a lot of nurses do have a shorter base of experience and stay in the same speciality to develop their knowledge. So they've got depth of knowledge, but it's normally quite narrow. And the timing of the instructing nurse work is important. I've been brought in on later cases when particulars of claims have been developed, and then that becomes more difficult because you're giving opinion on a particulars of claim that have been already developed. And so early instruction enables the nurse expert to examine the fresh documentation. And obviously, the nurse needs to have access to all of the documentation to be able to forensically go through that. And that's definitely what I've developed over these years, is being able to pick out specific details for cases that actually support the court to understand the case as well. The challenge when I came, I realised that there was no agreed definition of an expert witness, and this is recent case law. Anyone can call themselves an expert irrespective of their practical experience, academic qualifications, what training they've done, and whether they're registered with a professional body. Now, nurses definitely have to be registered with the NMC. They have to have current registration, and I believe that clinical experience ongoing is necessary, because if you're not based in the real world still, I was part of a conversation at a conference about when people retire, how long should they continue to do cases? And it's really, the cases when they've retired, that time frame should stop. So the case was a psychologist instructions was challenged on the basis that they weren't registered with the regulatory HCPC, Healthcare Professional Council. Which I think, as a solicitor instructing, that's one of your due diligence, to ensure that your expert nurse is still on the register. They're practicing in, not necessarily in the area that they are commenting on, but still practicing as a nurse. That would be one of the clinical suggestions that I would say is something to rule in. The other thing is how the courts review the experts themselves. I was reading some cases on how judges actually look at witnesses, and not just how their CV looks, but how they present themselves. And so the judge decides on what weight to attach to the opinion, examining the internal consistency. And what's really important is, are the witnesses able to give logical evidence? So, it's not just okay to say this is what, it's why, and what basis of experience, what basis of expertise that's based on. And obviously journal articles and evidence is really good guidance, nice guidance. Why has that opinion come to? But also range of opinions, because I don't think in a report there is just one way to present an opinion, and that's what opinion is. It's somebody's experience and knowledge. And I definitely think that a good report gives a range of opinion where there's a range of answers, and that actually supports the judge being able to understand that this has been a logical answer. And obviously being able to put this up in cross-examination, and anybody that's ever been cross-examined will tell you it's probably one of the most challenging parts of their day, or part of the case. And because we only have a small number going to actual court, then the expert getting experience of that is a challenge. So with this in mind, considering is the expert suitably qualified still, nursing experience. So currently there is a 3 or 4 year nursing degree, and you come out with a registration on the NMC. I recently went to an RCN conference, and there are paramedic nurse qualifications, dual qualifications, which is 4 years. And there is also a Master of Science nursing degree coming out now. So that's pre-registration. So then you register, and then you have a period of preceptorship post-qualifying. And there are different academic qualifications which can be done after. So a Master of Science, a doctorate, whether that's professional doctor or PhD. And as there's so many variables, as solicitors, what do you need to look for? And in my view, definitely a degree, nursing degree, and actually then thinking about how many specialities after that qualification there are. And I suppose there's as many specialities as there are cases that you come across. So everywhere where there could be a breach of duty, that there could be a nurse working in there. So theatre nursing, learning disability, mental health, safeguarding, district nursing, advanced practice in the community, palliative. The list goes on, and as I said, that nurses do specialise in, something like Parkinson's disease, or could be dementia. There is a wealth of nursing experience that can happen in the real world. I just want to stop for a second, take a breath, and see if there's any questions on what I've asked so far. Will?
Yeah, no, definitely. I mean, you mentioned, Wendie, how different areas of nursing practice require very specific expertise. So what advice would you give to a solicitor who isn't sure exactly which nursing discipline is most appropriate for their case?
Yeah, so when I get a letter of approach, I always look at where the clinical incident, the index event happened. So if it was in hospital, then as a solicitor, if I was checking that, I would want somebody with relevant hospital experience, because hospital and community are like two different worlds. So if it was I've got a few examples coming up, but if it was a case where somebody was diabetic and their diabetes wasn't managed well in hospital, and they had a breach of duty and causation, and they become more unwell, then I would want a hospital nurse dealing with that. If it was for a community case where a leg ulcer because diabetes wasn't well controlled, I would want a practice nurse dealing with that. So that they're very, very different worlds. So it's really important to have the right clinical expertise. But I don't necessarily think it has to be expertise where they're working right now. I think it can be expertise that they have experience of as well. Does that answer your question?
Yeah, no, absolutely. I mean, for those who may not instruct nurse experts a whole lot of the time, do you think you might be able to give maybe an example of where a nurse expert is essential rather than, say, a doctor or another medical professional?
Yeah. So if the breach of duty was actioned by a nurse, suspected breach of duty, that's when you need a nurse expert. Because a nurse can't comment on another professional, and another professional can't comment on a nurse's reasonable and responsible course of action. So, wherever there is a nursing concern, whether there could be a breach of duty, that's where you need a nurse.
Okay, no, absolutely. Brilliant. Thank you.
Yeah. So this goes on to the distinctions of experience and general practice. So a general practice nurse, so this as an example, works in general practice, wound care, vaccinations, cervical screening, ear irrigation, normally works to policies and protocols. They have vast amount of experience, very knowledgeable people, normally working on their own. So I've recently done a case where a melanoma was treated as a verruca, and the breach of duty, so failure to conform the protocol with a correct diagnosis, and then the delay in diagnosis due to trauma caused by the freezing. So you wouldn't be able to get a doctor to be able to comment on that, because the nurse is working as a professional. So a GP wouldn't be able to comment on that. But, conversely, an advanced nurse practitioner in general practice, they do work autonomously, assess, diagnose and treat, but not the same standards as the GP. And this is really interesting because as a patient, when I go into a GP surgery, I want the same care as whether I'm seeing a medical or non-medical person. So I'm not quite sure if that will come up in time, where, you know, should we be looking at the same standards, but currently the court would want a nurse commenting on even an advanced nurse practitioner rather than a GP. And most of the work that I do, a GP or another practitioner would say, I can't comment on this. And I would do the same. If it was GP, I would defer to a GP. So this is an interesting case where I did a screening report, and a case was judged by the claimant, by the defendant's team, where they were judged by a hospital ANP. And so it's a case of failure to assess sarcoma, which is soft tissue cancer. And there's nice guidance for sarcomas. And there was a breach of duty as the nurse requested an ultrasound scan, which bounced back. So in primary care, it's very rarely that nurses can request ultrasound. And it's these minute details that I think that's where the nurse expert comes into their own, because you would think that a nurse can request an ultrasound, but they can't. There's very few places where nurses, and it would be specific and it would be something that they've agreed locally. And so the case was judged by a hospital ANP, so advanced practice. The claimant, the defendant's team had said, can you screen this report? And the comment was it was normal for sarcoma to be missed. Now, I think that that is not reasonable or responsible. And, you know, it's not normal for sarcoma to be missed. And, you know, that's by advanced practitioners all over the country that do that, you know, and refer via nice guidance. So I think the challenge here was it was the wrong expert commenting on such a specialised subject with advanced practice in the community. And I definitely think that is, you know, one of the real key things about having the right expert, because the defence case can be, you know, to the nth degree to go to court, but actually, you know, that's not reasonable and responsible. And, you know, I think that's where we really need to hone down about having the right expert. Does that make sense?
Yeah, absolutely.
Perfect. Okay. So just a few more. So a few more practical thoughts about why choosing the right nurse with the clinical experience is necessary. So if there was a case of claimant in residential care, pressure injury causing sepsis, ending up in hospital with grade 4, pressure injury, you know, who would need to comment on this? And residential care has no nurses, so all nursing care is provided by a district nurse, so a district nurse experience is necessary. So I don't know of any care managers, and care managers are NVQ, highly skilled, highly trained, but I don't know of any care managers in residential home that do reports. So it would have to be a district nurse, because there's no nurses in and because district nurses provide all of the care, the nursing care and residential care. And so another claimant seen by a nurse in an urgent care centre, and a fracture is missed. And so that needs an emergency nurse practitioner or advanced nurse practitioner with urgent care experience to comment on this case, because specific working environments, such as X-ray, reading X-rays, they're done by protocols as well. And, you know, I think it's the specialist knowledge from the nurse expert to who knows what. And I think if you are selecting a CV, being able to understand, you know, where the index event happened, and ensuring that your expert has that right experience. Like I say, I get approaches all the time, and I look at I look at the details of the approach, and I look at the subject matter, and I know when I can comment and I know when I can't. And I think it's really, really important to ensure that we don't, as experts, don't step out of our lane. Because I say to myself, okay, do you know something about the subject? Yeah, okay. Can you do the report without looking at any guidance? Probably not. Okay, so maybe not. Do you know the guidance as part of your normal practice? Possibly not. Would you be able to be cross-examined on this? Definitely not. Okay, so that case is not for me. And I think that's a really good test. And I definitely don't accept cases that I cannot be cross-examined on. And I think that's a really good, test. If you have a nurse that you're unsure, either, if it's a direct approach or through Apex, asking, well, would they be comfortable being cross-examined on this? No, okay, well, that's not the expert for me. But I'm sure there is a lot of self-regulation with experts to understand what they can and can't do. And then I do think it's the elusive medico-legal balance here that actually swings it. So being clinically and being able to call oneself an expert, but training as an expert and reports undertaken, there are no set standards for this. So these are questions rather than me being able to give full answers. Should there be a minimum standard report and a minimum period for expertise? The training and writing reports, understanding of the CPR 35, sorry, there's a error there, and a period of mentorship. Now, when I did my training, and I still consider myself to be a lifelong learner. So, the basic training, as I would say, understanding about my duty to the court rather than to the defendant or claimant. I do think it's a real challenge when nurses start out to how they develop their skills. And I'm sure if I looked at my report from 5 years ago, the report writing style now is very different. And I think, how then do you say, is this the best report that I can put to the court as well? I don't know if I have the right answer for that. But I'd be interested in hearing your views if you have any. And I did find this interesting. So supervision in practice. There was a very unfortunate case where an expert witness for the claimant consulted her mentor during the course of finalising a joint statement. So after an expert discussion, and the interaction came to light when an email requesting advice was sent to the counterpart instead of through a mentor. Very unfortunate. I dread to think the feeling when that email was sent off, how that was. And then extreme concern was registered. And the court essentially determined that the expert witness must be independent and they should require no supervision in respect of the case. And I definitely feel that this is something, even with a new expert, their opinion must be their own, because the opinion of the expert is being judged by the court, as we said previously, where the judge looks at the expert and assesses whether they are the right expert and their opinion actually is valid to support their judgment on a case. And I think that's really important with the expert, ensuring that while they have had the ability to have some mentorship and support, that doesn't affect the opinion of the case. And I think that also goes to solicitors when they're reading reports and they're not quite sure if they agree with the opinion because it definitely affects the case. And I think, that's why, for me, giving an opinion, whether it's claimant or defendant, it should be the same opinion, in my view. So I'm just doing a quick case study before I go on. Any questions?
Does anyone else have any questions for Wendie? Please feel free to unmute yourself or type them into the chat if you do. One thing that I have written down, Wendie, you spoke about it before. You mentioned how even with something like an advanced nurse practitioner role, the scope of practice can vary greatly depending on the setting. Are you able to maybe give an example of where those differences might be particularly important in a say a breach of duty analysis?
Yeah, definitely. As I said about the sarcoma with the hospital nurse judging that, I think my main challenge is definitely the hospital nurses. So I don't comment on any hospital work now because I've been out of that practice for a while. So I don't any hospital emergency departments. I've done some work in there, but it's over 10 years ago, and that things have changed. Um, but there are some, really amazing specialist nurses out there, and things like Parkinson's disease. So a specialist nurse who works in Parkinson's disease wouldn't then be able to comment on diagnosis of Parkinson's by an ANP in a community setting because their expertise is very different. So a Parkinson's nurse would be doing this all the time, and they may have policies and procedures for diagnosing Parkinson's. It wouldn't be anything ever I would diagnose myself. So I don't think it's reasonable and responsible for a nurse to do that. That would be for a medic or a consultant to do. So unless you've had specialist training, but that's where the fine line can come. I do believe that a Parkinson's nurse may consider it reasonable and responsible for a nurse to diagnose Parkinson's in primary care. So that's splitting hairs, I do believe, but it's a very, very big distinction for the court to understand. And I think that is a really good example of the specialist knowledge of advanced practice in nursing.
Wendie, when you're reviewing a chronology of nursing care, what are some of the red flags you tend to look out for that might indicate a breach of duty would have occurred?
So we just look at this case study. I think that might answer your question. Is that okay, Will?
Yeah, of course. No, absolutely.
Yeah. So, I look at care home case studies and breach of duty often. And so, most common is pressure injury, where a patient has declined. So my previous experience and more recent, actually, as I undertake care home ward rounds for GPs as part of enhanced health in care homes. It's a national drive for people in nursing homes and residential homes to get better health access to healthcare. So if I was looking at a breach of duty, so I've got the experience, so that's the first thing I would say. What would be reasonably expected from a care home, and I would be looking at whether this is a residential or a nursing home. So we're going to say this is a nursing home. So a patient gets discharged from hospital to a nursing home. Let's say on discharge they had a grade 1 pressure injury. So a grade 1 pressure injury is where the skin blanches, so it goes white when it has pressure on it, but it actually recovers, so the tissue underlying recovers, when it doesn't have pressure on. So when somebody has pressure on it, the blood and the oxygen supply doesn't get to the tissue. So what can happen is the tissue can die. What we would want is on admission to this nursing home, that if they've been discharged from hospital, that a body map from hospital would follow the patient. And what the nursing home would do within 6 hours is check the patient over and agree or disagree with that body map. So cases that I've done is where a body map was done for 4 days. The patient came out with a grade 1 pressure sore. It's now a grade 4, so there's no evidence to say that the nursing home did what they should have done. Nice guidance, EAP, nice guidance. So, a body map should be done along with a water level assessment, which is to calculate the risk of somebody developing a pressure sore. A MUST score, which is to look at their malnutrition, their nutrition status, because actually those 3 things combined would indicate whether somebody is at risk of a pressure sore. So that's what I would look at. Were those things done? That would be my standards of care. So the care plan, which is once they've done all the assessments, what's the plan of care? So mattress, nutritional input, turning chart, was it in place? Is there evidence available? Clear information for the court. So this means looking through the care home notes, and it's a real challenge looking through, especially if you get thousands of pages, which I have had before. Sometimes there may be, it's because they're not paginated or they're not collated. It might be that you're actually sifting through thousands of pages to see, was this body map done? Was it compared to the hospital body map? Was it the same? Was it done in the same time frame? Was it done in the correct time frame? And there would be your breach of duty. And then obviously, I'm then looking at guidance, like local dietitian guidance, local tissue viability guidance, dressing suitability if there were any pressure sores, or care plan implementation. So evidence of that. And, the forensic notes review, the turning charts, correct assessment of water level, identifying what's not there and what what is. Because I think that is where the nurse expert comes into their own as well, is where they can see, where is that? Where's that piece of evidence that, would be necessary? And actually, we can't assess something that's not there. And we do know that, after the event, people will be able to write statements about what a standard practice is, and whether the court then chooses to accept that is important, because if the court chooses to accept, yes, this is standard practice, there's a statement to say that this is what this nurse's standard practice would be, then, I accept that. And that's not for me to judge, that's just for me to give a range of opinion, the range of opinion that if this wasn't done, as the evidence suggests, or if it was done, then the court is to decide which version they choose. And I definitely think that is how a nurse, how I work. I look at the letter of instruction. I look at what the solicitor is also thinking, but I also do think there is flexibility within the expert's remit to be able to say, actually, have you considered this as well? But, the timing that I was talking about earlier, the key timing for nurses to be instructed early, for this to be identified, the right experience, the right knowledge, and the right understanding of what should be there as well. And, the ability for the expert to be able to put all this in a logical way. Now, I've worked on my formatting for the reports over years, actually, and I really like the format that I've got now, because actually it tells a story. And that's what you need, because actually the judge will be picking up this report. He will have some knowledge, or she will have some knowledge of the case, but it tells a story. It gives a good chronology that I've identified myself. It gives a detailed idea of what should be expected, and then what's missing, and where the breach of duty is. And so, was that reasonable and responsible practice? Yes or no? Why was that reasonable and responsible? Why wasn't it reasonable and responsible? And what should have been done? Because I think that's the other thing, tallying it up between what was done and what should have been done. And I think this is a very challenging thing to do on paper as well. So just thinking about what experience is necessary for this case, what would the solicitor look for? District nurse, care home nurse, tissue viability. Can the nurse explain why a misassessment or failure for reposition matters clinically, and whether it represents a breach of duty? Whether the misassessment contributes to causation, the but-for test. I think, this is where coming down to the right expert, and I don't necessarily think there should be prescriptions about which expert, because obviously, in my view, there is a lot to do with communication and relationships as well. The relationship between an expert and a solicitor, although my duty is to the court, I do believe that I do have a responsibility to the instructing party, not that it would affect my opinion, but, to be able to explain my opinion as well. And I think this is, where solicitors really, that relationship-based work with experts is key. And I'm sure Apex have got relationships with different solicitors. I work with different agencies as well, and I get direct approaches as well. So I mean, it's really about that relationship base as well, and that's where I come on to the communication and the presentation of the expert, because you know the opinion, I think, really comes from how the person presents that opinion. And I think accessing the expert, I mean, I have reduced my clinical load now, so I do less, so I am very responsive to cases. And I think that's part of my IPO. I'm sure will agree that I turn around cases very quickly. And I think that's really important as a professional, to be able to be not just accessible, but to also be available for case conferencing, discussing the case if needed, report clarifications, and coordinating diary where multiple experts on the case. That's really important. I liken it to herding cats. I don't know how you feel, Will, but you know, trying to access people with their busy diaries is really challenging. And I would have thought for a solicitor that's really important to be able to access as well. The clarity and conciseness of the report as well. So explain complex information in a way that's easy for the non-clinician, the court to understand. And confidence and candor, confident and honest demeanour as the credibility of the expert. And as I said before, as the judge, you know, comments on the credibility of the expert, I feel this is really important. That you know the choice of the expert for the solicitor to manage the case is key. Any questions? Any thoughts?
I don't want to keep hogging it in case anyone else does have any questions, Wendy. But just briefly, I don't want to keep going back to what you've already spoken about, but we do get a lot of pressure sore cases. We see a lot of those type of cases, you know, day in and day out. So I do think it might be important to maybe discuss that a bit more. You know, you mentioned the importance in consistency, you know, of like turning charts and body maps and Waterloo scores. But like, how important is that consistency in those records when you're reviewing those types of cases?
So the challenge here is especially if it's over a long period of time. So you know, if the pressure injury you know occurred over 6 months, then so the standards that I would say, if it's a residential home and somebody would be on monthly weight. So if their weight started to deteriorate, their risk increases. So I'd be looking at monthly weight. So have they lost more than 5% of their body weight in that month? And if they have, they should then go on to weekly weight. And I think the challenge here is, well, that if you have missing evidence, it doesn't necessarily mean that it wasn't done. And I think the challenge is for the expert to highlight that the evidence isn't there, but not to form an opinion that it wasn't done. Because if you're forming an opinion it wasn't done and the court decides it was done, then actually your credibility could be affected. Mm-hmm. So I would be saying in my report, so I would expect a monthly weight. If there was 5% of body weight lost in that month, then I would expect it for weekly weight. I can see no evidence that weekly weights were implemented at this time. And I would be saying this would be standard practice and reasonable practice to identify risk of pressure injury. You know, if the court decides it wasn't undertaken, then this constitutes not reasonable and responsible practice and could have left the claimant at risk of pressure sores. However, if the court decides that this was done but just not documented, this is reasonable and responsible. And I think it's really using that careful understanding of that it is not my I'm going to say business. It is not my responsibility to make a judgment. It is my responsibility to present the evidence.
No, absolutely.
Yeah, and I think that's how I've seen nurses go wrong with saying, so this is a breach of duty. It's never my responsibility to say this is a breach of duty. It's my responsibility to say whether it's responsible practice.
Absolutely. Absolutely. You talked before about the value of early instruction, and how important that is, in your perspective as a nursing expert witness. Are you able to expand a bit more on why getting a nurse expert involved early in a claim can make a difference to a case, and how prepared the solicitor is?
Yeah, I find it really so I'll do a breach of duty report, and then 6 months later I'll get particulars of the claim, and my highlighted words for where there was wasn't reasonable responsible practice, that is then in the particulars of claim. So being able to use your nursing expert to understand where there is possibility for particulars of claim wording is key. And I think if you've already drafted particulars of claim, and then your expert comes along and says, well, that's to me that's reasonable responsible practice. So actually, you've not instructed a nurse, you might have instructed a specialist TVN. So I've got a case at the moment where there's a specialist TVN instructed, but actually the community nursing is a different standard of practice. So we wouldn't be judging a tissue viability nurse against a community nurse, and a hospital tissue viability nurse in particular, where there's very different challenges. So for me then to be able to say, well, this is reasonable responsible practice for a community nurse, I appreciate it's not the standard of a tissue viability nurse, but that is a specialist practitioner, and a hospital practitioner would have different standards. And I think that's key when you are trying to either defend or to present a case. I've recently been on a case where a young girl had a fracture, a pathological fracture, and it was considered, that the nurse, her practice was reasonably responsible because she'd already seen a couple of GPs and nothing was picked up. And I definitely think it's about the right person at the right time. And if you identify a nursing possible breach of duty, that's when it would be saying, okay, do we need a nurse to comment on this, to instruct a nurse, even on a very narrow subject field, if there's lots of practitioners. But I definitely think having the right nursing expert instructed at the right time can save a lot of issues further down the line. And we know how long cases take to progress, and actually being able to either decide on a case, so this is not worth defending, so having the right opinion, and of course the shopping of opinions between different experts is a wary thing to do as well. I know that courts look very dismally on finding the right opinion for your case, but maybe that's a different matter. Does that answer your question?
Yeah, no, absolutely. Thank you, Wendie.
Perfect. Okay. So I've just got a couple of things that I'd like to, we've got 15 minutes, so I'd just like a couple of things to say from my perspective, what makes a good instruction. Now, I know this is a converse to what you're expecting, but I love a good letter of instruction. So answers. So the report considerations. So does it answer all of the questions posed by letter of instruction, or evidence been utilised, and clear expertise? So this is what you should be looking for. I think I've actually said something else later on. So clear. So what report considerations are you looking for? Answers all the questions, evidence used, clinical expertise, clear on the CV, because it's a standalone report that goes to the judge. a logical argument, use of guidance in time from an index event. If the guidance is not used, how is it rationalised? And sometimes I will look at guidance and I say that's not really what we do in general practice, or that's not what we do reasonable responsible practice. That's a very high standard and it's not attainable. So I will then say why that's not utilised, why the guidance is there, but in standard practice, reasonable responsible practice is actually done. And has the legal test been applied? I think, whether we're in England, so Bolam and Belite test, I think it's really important that is, firstly, I put that on all my reports. I put it because if I'm ever stood in court with my report and I forget the Bolam Belite test, I've got it there. And then if there's different scenarios, how has this been handled? If the version accepts X, version of events, opinion Y, and how do they handle the lack of evidence to support the opinion? And I've got the ARCSI Cambridge University, where the pitfalls of a claimant appointed expert, they produced a report, and once they'd seen the report, they didn't change opinion or provide an addendum. They attended the discussion. Defence appointed expert read the statements referred to in his report. During the discussion, Mr. F, the claimant appointed expert, did not ask to see those statements or further records, and said he maintained his original position. And this is a real challenge, I think, from an expert's perspective. Changing your opinion can actually affect the case, but the sooner the better. So if I see different evidence, and that's, I'll go back to where the weekly weights I didn't think were done, but they were done. So then I have to change my opinion. And at trial, he was cross-examined and with additional evidence, and Justice Spencer's was unimpressed, far below expected standards for an expert witness, noting his aura of evidence, the continual apologies, the magnitude of deficiencies became clear. Well, that's the end of his career, really. And I do appreciate my role as an expert witness, and I think my due diligence and my ability to make opinions based on the information I've been given, and I think that's what makes a good expert.
Oh, Wendie,
okay, so
we've got a great question here from Dawn. She just asks, do you like to hear the opinion of the instructing party when they send a letter of instruction, what they think is negligence / what they think is defensible? What are your thoughts?
Well, I think the letter of instruction for me is what questions are you asking? So you will have already formed an opinion as a solicitor. You would have already formed, I do believe, with my experience that, there could be a breach of duty here. So a pointed question as, on the 28th of April 22, this wasn't done. Is this a breach of duty? And then I can comment on that specific date as well. And I also think what's really good is if solicitors are looking for a timeline. So if they're looking for where was the index event, where was the problem that came along, where did this all start? Because that's what we're looking at, isn't it? We're looking at who and where and what and when. And if that's what you're looking for, a question for experts to say, can you see where the index event? For example, there was a chap that on a case who had an appendix. He saw a nurse. She didn't. There were no pointers toward appendix problems. Pain score was low. He saw another nurse, and once again, no appendix. Went to hospital 3 days later and had an appendix. So where's the index event? And I think from a solicitor's perspective, understanding that and being able to get the expert's opinion on that is key. Does that help, Dawn?
She's giving a thumbs up. Are there times where when you find the instructing party's views helpful to understand context, even though you still have to come to your own conclusions, obviously?
But I think this fits well. So I'm just like to say, what makes a good instruction? The
Oh,
experts use.
absolutely. Do carry on.
And I think what I appreciate, and I can't speak for all experts, but from an expert perspective, which I think is very useful for a solicitor, an informed letter of instruction. So a brief timeline. So I do get instructions where there's been a comprehensive timeline made, and I struggle with that because I don't ever use the solicitor's timeline. Sorry to say this, because a good expert, and I do think that that's where I sit. I definitely make my own timeline up, and I think that's really key because factual errors can actually be perpetuated, and even if that's from the claimant's perspective, a factual error, and that's what the solicitor is telling you, that is not necessarily the case. So you have to then be clear on the actual facts from the evidence given. So a brief timeline for me is great. The deadline of a report, I've read a case recently where there was a deadline of a week, and the judge said that that definitely wasn't appropriate for the expert to turn around the report. Whether this is pre-proceedings as well, I do feel that I'm playing catch up, especially if I'm claimant instructed. If it's already gone to a letter of proceedings, and then I'm definitely on the back foot. So if this is pre-proceedings, I do actually appreciate knowing that. Clear questions, so concise questions to resolve any queries. As I said, I do think that solicitors already have a view on the case, and they're looking for their expert to clarify that. And highlight any areas where a range of opinion would be needed. I find this really helpful with directions as well, so that if a solicitor, I'm not quite sure, what would be X if Y and what would be A if B. And a good instruction, so any report clarifications are within 10 days to help with the flow of reports. So I do move on quite quickly, and like most things, I've got mine like a goldfish. It's not in front of me, and I do forget. So I having to go back on a case to understand everything, read my report again. So that really helps me. Prep time for case conferences and the clear agenda for joint discussions. I think my experience of joint discussions without set and very clear agendas is that they can cause issues. And I think, the best instructing solicitors for me are those who have clear agendas of joint discussions, because then we are not discussing anything outside the purview, which I think is really important with cases, because especially if there's a very narrow scope of particulars of claim, you want to be discussing those for the judge to have a joint review. So I'm just going to do a quick summary, but Will, are there any questions before?
I don't know if there's anyone else that would like to, like Dawn, just pop in their questions in the chat, or feel free to unmute and ask Wendie directly. That's not a problem at all. I think yeah, I think I mean for me, I liked when you were speaking, or I found it very interesting when you were talking about making sure the solicitors are instructing the appropriate nurse for their cases, and for solicitors who are unsure about what type of nurse expert they need, what would your advice be on matching expertise to case types?
Oh, no, I'm not sure. I think having a nurse expert that can assess cases rather than assess CVs, rather than solicitors doing it, and I definitely think that it's definitely would be a really useful tool for solicitors to have. And I don't know about any. I know that there are larger firms of solicitors have their own experts to screen cases, and I know that, but I actually do think having and relationships, having relationships with nurses that understand the cases as well. So I think there's a twofold: having a sympathetic nurse on staff that actually can, especially where you have, I need an opinion on what nurse I need for this. So I'm sure, Apex were able to give that support as well, because they do reach out to us. But it's also being able to, challenge the nurse that you're possibly instructing to whether she's actually got that or he have got that experience as well. So I think there are strategies that companies can put in place. And I do think, having the right expert is key, and having a professional discussion about why the expertise is the right expertise is possibly more valuable than a legal to nurse conversation. Does that make sense, Will?
Yeah, no, absolutely. Thank you, Wendie.
Good. Yeah. Okay. So just to sum up, the right clinical experience to comment on the case, with expertise to inform the court, an appropriate amount of clinical expertise, and training as an expert. Availability, so do they have availability in their diary for the case? Ensuring that the report deadline can be made and the experts are aware the case can take years. Some of the new experts that I've come across, they've decided they don't like it. And when you then say, well, I appreciate you don't like it, but you've actually signed up for a case now, and that case is still yours, the court would not, look kindly on the fact that this is going to progress and you're not going to continue with it. So ensuring that the nurse understands that. And I know that Apex do put that on their instructions when I accept an instruction and when I deliver a report, that they confirm that. And I think that's a really good strategy as well. The communication of accessing expert and presentation of their work. And I was reading about costs, and because obviously some smaller cases, the cost of expert can outweigh the actual claim. It's really key, but we'll go into that another time maybe. Perfect.
Brilliant.
How's that, Will?
Yeah, well done.